I'm Graham Connolly. I'm a research psychologist and I'm a senior lecturer in the Department of Educational and Professional Studies at the University of Strathclyde. I was the principal investigator for the research, and there were about 8 other colleagues who at various points were involved in the research, mostly from my department, but also from the Glasgow School of Social Work, particularly the Scottish Institute for Residential Childcare. The pilot projects were in local authorities across Scotland. They were quite different. Some of them, for example, were aimed at improving the attainment of all looked after children, and others concentrated on specific aspects. For example, nursery-age children or children only in residential care. One example involved nurture groups for very young children. Another example was concentrated support for the education of children in secondary 3 and 4. Although the projects were very different, there were of course similarities, and we classified those into 5 broad types. Firstly, direct support, for example, additional tutoring. Secondly, the use of personal education planning. Thirdly, support at a transition stage, for example, nursery into primary school or primary into secondary school. Fourthly, developing capacity amongst parents and amongst workers, training for workers, for example. And finally, the use of computer or information technology approaches, for example, wiring up computers within residential children's homes. The research was carried out over a 2-year period from September 2006 until June 2008. It was a mixed methods approach. We collected baseline data about children's attendance at school, exclusion and attainment in the year prior to the project, and then we attempted to collect the same information, we called that outcome data, approximately 1 year later. The qualitative aspects of the research involved conducting interviews and focus groups with key participants. These were the project organisers, various workers, included teachers, social workers, carers, and also crucially the young people themselves and in some cases their parents. The research is part of a wider programme resulting from the implementation of Looked After Children We Can and Must Do Better, a government report which was published in January 2007. That report had 19 key actions. One, for example, involved Scottish Government having a champion for looked after children. Another included a lead officer in each local authority championing looked after children. As well as the research, there's also been the development of a DVD-ROM of training materials for professionals who are working with looked after children. The implementation, of course, isn't just about education, and it has implications for others working with looked after children, crucially those in the health area. In the research we had data at 2 points, baseline and outcome, for more than 600 children and young people. And the research confirmed, unfortunately, what we already know about looked after children, and that is that their outcomes in education tend to be poor. But we were quite surprised to discover that in a relatively short space of time there were improvements in the outcomes for looked after children. For example, we found that in about 40% of our study population, the outcomes measured in 5 to 14 national assessments in English reading, writing and mathematics improved significantly, much better than for most looked after children, and about equivalent to those children who are not looked after. We also found that those looked after children who had had high engagement in the pilot activities made the most progress. Those activities were quite varied. They could, for example, be quite explicitly about support for education, like extra tutoring. Or they could be activities, for example, like engaging in sport or in drama or participating in a holiday. I think there are three main lessons from the research. The first is that professionals need to have better understanding of the needs of looked after children. That's particularly important for schools and for teachers. They need to know, for example, who their looked after children are. Secondly, it's important that we monitor very closely the progress of looked after children. Research shows that they fall behind very quickly, particularly because of the instability in their lives, and it's important that we monitor their progress at an individual child level. And thirdly, the message from the research is that being able to participate in activities actually has an impact on their progress. And it probably doesn't matter what those activities are. The important thing is actually engagement. During the research project, we found difficulties in collecting data about looked after children at both baseline and outcome stages. That wasn't because of any lack of willingness on the part of the project managers, but it was because local authorities' systems are often not robust in relation to collecting data about looked after children. We also found that the project managers had underestimated the difficulties they might experience in relation to collecting data. For example, they would depend on other people, perhaps in a different department, to collect that data for them. And also the organisational arrangements tended to be quite complex, and they had given insufficient attention to those details. As well as the research report, we've also prepared a separate document, Guidance for Practitioners. That's aimed at a whole range of professionals in local authorities and other service providers.